Hello, today we have Dr. Prashant Suru with us. Welcome Dr. Prashant
Thank
Suru.
you.
He is postgraduate from Tirak Ayurved College. After that he was sometime teaching there. Since 26 years he is practicing on his own. He is spreading this Ayurvedic knowledge abroad through lectures, consultancy and reading papers in various countries. Also he is involved in Kerala Ayurveda. He is disciple of Datar Shastri and following his Panchabhautik Chikitsa. Dr. Suru, I will ask you some questions.
Sure.
My first question is this course is available after 10th class or 12th class? And what is the admission process and what duration?
Yes. The BAMS, Bachelor of Ayurveda, Medicine and Surgery, is a recognized course of Government of India. CCIM is the apex body for it. So all over India, the same course is designed and followed all over India. The graduation needs basic qualification is 12, that is 10 plus 2. There are two types of colleges. The first one is a government college. The another group is non-governmental. There are two types of again. First is granted and is non-granted private colleges. So for the private colleges there is something different CET taken by their private group, their association, and for general, in general for the granted colleges and governmental colleges, the admission is given through the CET taken by Maharashtra government here in Maharashtra. Every state has their own common entrance test. All India test is not there. After BMS we have facilitated with the postgraduate education all over India in a different subjects, MD Ayurveda or MS Ayurveda. So the admission process has its own transparency, clear picture, and after 12th the student of science who is having his PCB, the physics, chemistry and biology, they can get admission to any of the colleges.
What subjects are taught and how it is different from medical field?
Basic education of any medical field consists of anatomy knowledge, basic body physiology, then the pathology, and then the diagnostic methods will convert it in a part of the treatment. So it's called as medicine. These are the basic things to any of the medical fraternity. Might be homeopathy, Ayurveda or the allopathy. The difference starts only from the basic principles, line of treatment and use of the herbs, minerals and other medicinal formulations. For example, in homeopathy they taught materia medica. In allopathy they have a separate subject called as pharmacognosy, pharmacology and other. Ayurveda also has its own predominant subject called as Dravya Gun, Rasa Shastra, Bhaishajya Kalpana, which deals with all the basic knowledges of formation of medicines. So that is the difference. But the privilege of Ayurveda, it is an indigenous medicine. It is a lifestyle. Ayurveda means itself the science of Ayurveda, science of life. It is dealing with the life science. So it is not a only treatment part, but it has that prevention in mind. We don't say that prevention is better than cure. Prevention is our prior and the first and foremost duty to follow to keep ourselves healthy. We call it as a swastha. So you get the bliss of life with this. Even if you are not ill, you are supposed to follow the rules and regulations, the daily regimes, what we call as a dinacharya, rutucharya. That is what we are following in our life. Our ancient people, all the ancestors and the sages have followed that, and they have a good, long, healthy life period for that. So Ayurveda has its own philosophy, and that philosophy comes under Padartha Vidyan and other subjects dealing with surgical things. Ayurvedic surgery is something different. For example, Kshara Sutra, Agni Karma, Rakta Mokshan. Then the body cleansing method is a speciality of Ayurveda called as Pancha Karmas. So that everything comes under this course. and after that you get a degree called as Bachelor of Ayurveda. Then you can get master's degree in a specific ENT, ophthalm or gynecology or the pediatrics according to Ayurvedic basic principles. So the syllabus content is almost same. Basically we have to learn the modern science. I'm not labeling it as a allopathic science, but that is a basic available modern science which is based upon the physics, chemistry and biology. That is also needed for our sake. Nowadays, with the modern era, we have all the modern equipments to help us for the diagnostic purpose. Extended tests which our sages were having, antardhyana or antardrushti, that is now an extended part for the diagnostic purpose, and we have to learn that as well.
Do they teach in the college preparation of medicine?
Yes, madam. When the diagnosis is confirmed, then the first and foremost duty is to select a medicine. So how to select a medicine, on what basis, on the which basic principles, that is more important. That is already we teach that part first, and then the selection of medicine. Once the medicine is selected, how to prepare it is the next part. Not only to prepare, but for a simple formulation we may need different herbs, some minerals, some bhasmas of metals, non-metals, everything available in this earth or that world, cosmos, is has its own medicinal value. So we use every single thing as a medicine. Even our food becomes our medicine. So we ask to follow the regimes according to that. So diet restrictions is also a part of medicine. So once we suggest something as a medicinal value, we keep it in mind the qualities of that particular thing. Not only that, one formulation contains many combinations. Then what the raw material has to be there, the quality, assurance and quantity, everything is confirmed. Followed by that combination, the process. Ayurveda has different types of medicines. We have powders, we have raw material decoctions, we have hot effusions, cold effusions, asavas, arishtas, bhasmas, pottalis, rasa. Everything is different to prepare that. So that process is taught into the college. But before that, to get the healthy raw material is very important. From where, which part of the medicine is to be collected, which part of the medicine is to be picked in which season, that is also important. So that is more important to know rather than just mixing a powder. So you get good quality of raw material, in a proper time, proper season and proper preparation. Everything will make the healthy, best, easy, assimilable form of medicine, and that is taught into the college.
Do a person need to know operating latest machines or softwares?
It is rightly said, to know the basics is a basic qualification. To enhance and improve your qualities, to know many science. Ayurveda says, Na vidyat shastra bheshajam, with knowing one science. It is better to know many sciences, science fields at a time. For example, nowadays, due to the technical revolution, we have many instruments, we have many helping hands, scopies and x-rays and CT scans and everything. There were no such equipments in prior in history, but the practitioners at that time have received tremendous miraculous results. Nowadays, these are the things which are beneficial to make our diagnostic methods easier. So one has to know them. It is better to know them, better to handle them, and it will be an additional feather in his cap to know these things for future, and one has to run with the present era. So whatever the best possible available has to be adopted.
What are the skill sets required if one chooses to go for this field?
To go for any of the science subject, it needs three minimum requirements. The first faith and belief on that particular science first. You have to dedicate yourself for that science, know the thorough knowledge of that particular thing, and then you can utilize it better with the confidence. Next thing, with faith and belief, it needs inquisitiveness. You need a scientific background in mind that has to be skilled. You don't get these skills by birth. That should be adopted and has to be developed by your own. With inquisitiveness, you know many things. Deep thinking, musing on that particular thing is more important. The third thing, to know many languages and many other sciences will be helpful. For example, just to give an example, if somebody doctor knows medical palmistry, by looking the pulse of the patient, along with that simultaneously if he can read the palmistry, he can help him in another way as well. So it is not necessary, but it is an additional help for him. Sanskrit is a language, mother language of all the Indian originated languages, and Ayurveda is basically was written in thousands of the sects, what we call as adhyay, and were in Sanskrit. So our basic three major manuscripts, textbooks, are Charak, Sushrut and Vagpat Samhitas, are basically in Sanskrit. Their commentaries are available in different languages and translated nowadays. But if one has a prior knowledge of basic Sanskrit, Vyakaran and some philosophy background, will be an easy thing, easy landing for that particular student. So if you have basic knowledge of Sanskrit till by 10th or by 12th, it will be beneficial.
What are the opportunities for higher education in this field?
They are very high. To learn something after graduation, Ayurveda gives thousands of options to us. The first is something in the same field, that is Ayurveda. You can take your post-graduation study in any of the other subject. There are around about 15 basic subjects in which you can get your master's degree in field of Ayurveda. Once you get that, there are postgraduate diploma courses, different subjects, different specialities. For example, in Panchakarma you can do, in Balarog, that is pediatrics, you can do, in Ayurvedic field you can do the ophthalmic some treatment, then formation of medicines, Ayurvedic pharmacy, post-graduation in that, master's degree in business management or business administration with specific Ayurvedic pharmacy or with specific healthcare and hospital management. These are new avenues open. Nowadays, MUHS, the Maharashtra University of Health Sciences, is also running this course specifically for all pathy doctors. So that is one new avenue available. Even after BAMS, one can get something with all other fraternities. They can do the School of Health Sciences and they can have a combined joint venture and study and do research with some other pathy and some other science as well. Then these are the new MSc in that particular field, basic science. You can do that with graduation of BAMS. Obviously, Ayurveda is predominantly in India. Abroad, you don't get good education of such thing. And to learn Ayurveda abroad from Indian student is not expected. So you don't get MS degree from USA in Ayurveda. But you can take Ayurveda to abroad as a teacher, or you can give them whatever the knowledge we have. So that is one avenue available. Instead of learning something, you can get admission for some other course and introduce our science to them as a complementary science and knowledge.
Is there any further scope for research in Ayurveda?
Ayurveda is a basic flowing science. It is not a stagnant one. From the beginning, the validity and the magnitude of the basic principles of Ayurveda remain unchanged since around about 5,000 years and more. The newer science change their basic principle every 10 years, 5 years and 3 years. The first antibiotic range has now none of the use and the second generation comes, then the third, and then the first goes away. But in Ayurveda, the research has a tremendous scope. The sky is the limit, or you can say the ocean of research is open for student. Everybody can put his own input to enhance the Ayurvedic science and to give new thing to the science. For example, previously only the fever was there. Jwara is mentioned in Ayurveda. Nowadays we get a specific jwaras called as like swine flu. Is it a new disease? For modern era, it is a name new disease. But for us, it is a basic principle remains same. We diagnose that particular disease according to the epidemic and the cause, and we treat the cause, not the symptom. That is the major difference between any of the other science. So, you have a scope, unlimited scope for research to help people for that particular newer disease, for AIDS, for other things, for swine flu. Now, however, there are SARS. You get new diseases. They are not new diseases. The symptoms are same. The name is new. The old bottle, the new wine. Like that, we have the old wine in a new bottle. Basically, Ayurveda has scope of research. Everybody can do his own principles without disturbing the basic one. So you can put your new formulations, you can do new trials, errors, and that gives you best research possible.
What are the opportunities in this field for jobs or self-employment or for the practice? And what is your advice for that?
Depends upon everybody's nature, mental state, and his own perception of his own, what he wants to be. For example, somebody wants to be employed, earn a certain amount every month and do his work. There are few, they are ready to help the humanity according to their own qualities. They want to serve people, they want to just do service for the society. Then they have to join with some NGO or some institute or some social worker. He can join. Those who want to earn money for themselves, they can practice and earn money. Those who want to do service to society and something for me, then he can do his own or he can join to any of the job. I will explain which jobs are available, but there are few. They do the service to the science and they do the research and they dedicate their life for the science. That is more important. You can get this in any of the type. First things, start your own clinic. Second thing, you can join, have a group, form a hospital or something, Ayurvedic center in which research is also associated. So that can be done. See, different specialized students can join together and have one holistic center. That will be the ideal thing. In government, nowadays, graduation, BMS doctor are welcome and they get good jobs all over state level or at, you can say at central government as well. For example, Ayush department. Nowadays, all the social and local municipal corporations and all other they run Ayurvedic clinics on their own. You can get a good job over there. Ayurvedic pharmacies offer good job for Ayurvedic doctors. Ayurvedic nutraceutical, pharmaceutical, and nowadays what we call as a Ayurvedic foods, new era, cosmetics, they need Ayurvedic doctors to help them. So they get good jobs. Hospital management is another skill, they get good jobs. So at private level, in private sector, in public sector, and at social sectors like social institutes, NGOs, they also offer good jobs for Ayurvedic doctors. So Ayurvedic doctor has tremendous scope. If they want to work under somebody, they get good jobs, good money, good fame, good name, And if really they want to do something for the science, they can start their own, run their clinic, and what they get, they are not interested to get the name and fame and the money, but the blessings they get from their patients, that is the first and foremost thing. So to get blessed by patients and to get satisfied that yes, I treated a patient and he is cured, that's the ultimate one according to me. And I wish all the best to all the students to get such a great satisfaction and bliss in their life. All the best.
Thank you, doctor,
Oh.
for coming here
Thank you.
and enlightening on the subject.
Thanks a lot.
Thank you.